Thank you, Marilyn, and welcome back from break, everyone, and welcome to everybody that is joining us online. I'm pleased to welcome you all to this second plenary session titled Vaccine Hesitancy and Ethics, Can We Talk? Prior to commencing with the formal presentations, I just have a couple of housekeeping items I want to remind everybody of. I would like to remind our on-site participants that in your forum delegate packages, there is an evaluation form that we'd like you to fill out, and probably a good idea to fill it out as we're going along so the information is fresh in your mind, and would be greatly appreciated and will be invaluable as we plan the next Western Canadian Immunization Forum. Secondly, I want to point out the question boxes at the back of the room, and they will be in each of the breakout session rooms. So if we do run out of time, or if you think of something later on, or you just don't want to stand up in front of the group, please feel free to use those question boxes. And the organizing committee will make a very concerted effort to answer these questions and have them posted onto the Western Canadian Immunization Forum 2014 webpage, which is located on the Alberta Health website. For this session, we have three very distinguished physicians, and I feel very fortunate to be here introducing them this morning. Their presentations are going to focus on assisting us to gain a greater appreciation of the seriousness of communicable diseases and the tremendous values that vaccines have against these diseases. Also to increase our confidence in our approach to parents who are hesitant to immunize their children, to describe some ethical considerations around parental requests for so-called designer immunization schedules, and to assist us in our roles in addressing challenges regarding conflicted consent for childhood immunizations. We have excellent programs, immunization programs in Canada. Vaccines have positively impacted our health in our individual jurisdictions, nationally and worldwide. However, the number of vaccines in our immunization schedules are growing, and then some ask, do we have too many vaccines? Our first presentation in this plenary session explores this question, vaccines, too many or not enough. I'm pleased to introduce our first speaker, Dr. Jim Kellner. Dr. Jim Kellner is a pediatrician and subspecialist in pediatric infectious diseases. Currently, he is professor and head of the Department of Pediatrics at the University of Calgary and Alberta Health Services, Calgary Zone. He is also professor in the Department of Community Health Sciences and the Department of Microbiology, Immunology, and Infectious diseases. His research interests are in the field of preventable infections, including, in particularly, Streptococcus pneumonia, Neisseria meningitis, and influenza. He founded two research groups, Calgary Streptococcus Pneumonia Epidemiology Research, CASPR, and Alberta Children's Hospital Infection Epidemiology and Vaccine Evaluation, ACHIEVE. He is also a member of the pneumococcal working group for the Canadian Impact Monitoring Program Active, IMPACT. He is chair of the Alberta Advisory Committee on Immunization that advises the Government of Alberta. He serves on the pneumococcal working group of the Canadian National Advisory Committee for Immunizations, which is called NACI, and is a member of the WHO Serotype Replacement Technical Advisory Group. Please welcome me and welcoming Dr. Jim Kellner.
Well, thanks, Pamela, and good morning, everybody. It's a real pleasure to be here this morning. And Pamela's got her red sign and her white sign to tell us to keep on schedule, so I'll do my very best. I once gave a talk where the moderator, English wasn't the moderator's first language, and when I was getting close to the end of my time, the moderator just put up this sign saying, "It is over." And so this is a much more gentle approach, but I will try to stay on time here. So really, the presentation I want to make, vaccines too many or not enough, I feel like to this group, it's really a bit of a Coles to Newcastle kind of presentation. So I apologize in advance for anything I say, which most of what I'm going to say is just reminding you or bringing up information that everybody in the room is very, very familiar with. And I hope I can offer a couple of nuggets to sort of enhance everybody's strong understanding of this issue. So in terms of disclosures, I have had research grant support from Pfizer regarding pneumococcal disease surveillance programs. In Sanofi Pasteur, we're doing a clinical trial for pertussis vaccine for pregnant women, and have received consulting fees from Pfizer and Merck related to their pneumococcal vaccines. So objectives for my presentation here, there's three really. Review the effectiveness of current routine childhood vaccines. This is not going to be news to everybody. Review important infectious diseases that are not yet controlled by vaccines, and then review progress in the development of new vaccines. So we all know that when it comes to the control of infectious diseases, vaccination, primary prevention through immunization or vaccination is the most important way that we can, and most effective way that we can prevent infections. You can also prevent infections through prevention of transmission, which is also an area of a lot of work to try to see how we can improve that, especially in the hospital settings. Prevention of disease through improved host defenses for the small proportion of the population at increased risk, and then of course treatment of disease. But our aim in the world of immunizations is to try to avoid having to treat the diseases in the first place. Many people will be familiar with this. That came out more than a decade ago, but in the United States at the end of the 20th century, a list was made of the 10 greatest public health achievements in the 20th century, and included in there was vaccination. And really, although vaccinations have been around for a long time, over 250 years, the 20th century was really a golden age in terms of increased development and delivery of vaccines across the world. And update on information presented back then. Really, this is a list on the left of vaccine-preventable diseases where we've had vaccines for a long time, and then some number of cases, not in the middle, but on the right-hand side, a row showing the percent decline in disease. And the great news is that for the vast majority of those diseases, the percent decline is somewhere around 99 to 100%. So we have been really, really effective at controlling disease in places where vaccines are routinely delivered. We all know that. In Canada currently, we have a lot of vaccines available, 25 different licensed vaccines, of which 15 are routinely used in many provinces, just 14 routinely used in Alberta here so far. So there's a lot of licensed vaccines available for use in Canada. And I'll say I'm sorry for those who are in the middle or at the back. You can't see the bottom of the slide so well, and the punchlines on all my slides are in the bottom, so I apologize that I can't see all the great stuff. But you'll be able to download them from the internet after this is over. Just sharing, our schedule in Alberta is similar to BC, similar to Saskatchewan, similar to Winnipeg, but not identical. We currently vaccinate against 14 infectious diseases. By grade 9, not counting influenza, children in Alberta will have received 21 injections at 10 visits, and they'll receive 9 different single or combined vaccines. If you added in influenza, that would be up to 15 additional injections. And I just skipped over the last one, HPV. Currently HPV is still just delivered to girls, but later this year we'll be starting to deliver HPV to boys in Alberta, which is great. What's not so great is that we don't have a rotavirus program yet, unlike British Columbia to the west of us and Saskatchewan to the east of us. So this was the slide I was most nervous about showing to a crowd of largely vaccine providers, but since every speaker so far this morning, starting with the health minister, has commented on the fact that our actual uptake of vaccines isn't spectacular and isn't perfect, I'm not so nervous about it. And I realized in the handout package as well, there's a slide that was shown that has a little bit of updated information or more comprehensive information from Alberta, as well as from British Columbia in terms of uptake of vaccines. So nowhere really in Canada are we perfect at delivery of vaccines, and I think that remains an important issue. Now, it's not all bad news, because with less than perfect delivery, we are actually controlling many infections really, really well. There's some notable exceptions, pertussis, measles, and influenza especially, but less than perfect delivery results in really good control for some of the things that we're trying to immunize against. So my first conclusion, it's not the end of my talk, however. In Alberta, we have an excellent program of universal vaccination for children, except for rotavirus, but the uptake to date has not met targets. It's not all bad news, but it's not ideal. So not all vaccine-preventable infections are well controlled in children. And I think you can make the case to say that in Canada, at least the following list of vaccine-preventable diseases for which there are vaccines available today are not well controlled. Diarrhea, because of the availability of the rotavirus vaccine, has not been completely taken up across the country. Pneumonia, all causes, and I think there are different ways that we prevent pneumonia, but especially through use of influenza vaccine, pneumococcal vaccine, and if you want to hear more about pneumococcal vaccine for adults and pneumonia prevention, we'll be speaking about that briefly this afternoon. Pertussis, the vaccine isn't perfect and the uptake isn't perfect, and we have a lot of pertussis issues. Meningitis, there are 3 different meningitis vaccines, not perfect uptake, reasonable control but not perfect, influenza, and then measles. So, and again, just the next couple of slides, you could choose either pertussis or measles, especially to say here are instances where in Canada and North America we've had issues with significant number of cases of disease in recent times, and I just chose pertussis because there's been issues throughout North America, starting in the US especially, and then across Canada with really very large outbreaks over the course of the last several years. And so it's a story from last year. This is data from the US just going up to 2011, but showing huge spikes in the incidence of pertussis disease in the 2000s. You know, in California in 2011 and 12, there was a 60-year peak of pertussis cases and 80 deaths in infants from pertussis. So the impact has been huge. So some of the diseases that we're not controlling all that well. Now, just to take a bit of a more global perspective, you know, where are we at in terms of controlling vaccine-preventable diseases and infectious diseases globally? And this is a busy slide, but it's kind of refers to a very interesting website, this Institute for Health Metrics and Evaluation, supported by a variety of governmental and non-governmental organizations, the Gates Foundation, but put together this study, The Global Burden of Diseases, Injuries, and Risk Factors for 2010, and the data was released last year. And you can go to this website and build up all kinds of interesting pictures of disease incidence and prevalence and the impact across the world. And so one of the things you can do is you can build pictures that look like this. And I know this one is hard to see if you're at the back, but there's really 3 colors here. Red, which refers to communicable maternal neonatal nutritional disease, blue, which refers to non-communicable disease, and green, which refers to injuries. And so this is causes of death and morbidity measured in something called DALYs, disability-adjusted life years, for children under the age of 5 in Canada in 2010, the year for which this data is available. The important thing to see here is that the red box is pretty big, and within that red box there's a lot of infectious diseases, lower respiratory tract infections, diarrhea, pertussis, meningitis, neonatal sepsis, and the like. So under the age of 5, infectious diseases remain a very important cause of morbidity and mortality in Canadian children. Now, if you look at all ages in Canada, this now, the red box, which from the back you can't see at all, shrinks down to something very small. So the infectious diseases, morbidity, mortality, when you look at all ages, has really become relatively small. And I think it's part of our issue when it comes to vaccine delivery, is because it's not really an adult issue, although it is an adult issue, but non-communicable diseases, the blue box, becomes the overwhelming component of morbidity and mortality in disease in Canada. So worldwide progress in controlling infectious diseases. There's great news here. Before I get to that, just one more thing is, from a worldwide perspective, again, not all vaccine-preventable diseases are well controlled. And so this is diseases for which we have vaccines available right now. So I think the list is the same as what we see in Canada on the left, but then worldwide there's some other diseases for which there are vaccines, not always perfect, but vaccines available that we haven't well controlled. And these include tuberculosis. The BCG vaccine isn't great, but it does have its role so far. Tetanus and typhoid. Tetanus very well controlled in Canada, but worldwide not at all. So there's a good news, bad news thing when you look at worldwide childhood mortality, mortality being the sort of most crude measure of health in children, but when you look on a worldwide basis, the numbers get very large. If you look at the decade from 2000 to 2010, shown in the column on the left here, the great news is there's been a 1/5, a 20% overall decline in death in children under the age of 5 per year, and then a 22% decline in mortality as a rate per 1,000 live births. It's saying the same thing. The not so good news is that we've gone from 9.6 million to still over 7.5 million deaths every year in children under the age of 5. And of those deaths that occur in children under the age of 5 worldwide, 2/3 of them, or almost 5 million, are due to infectious diseases still in 2010, with the top 3 being pneumonia, diarrhea, and malaria in terms of cause of death in children worldwide. So when you look at that and say, how many of these deaths are vaccine preventable today with existing vaccines? And this is from a slightly different data set, but the best estimate is about 1.5 million deaths a year that occur in children under the age of 5 due to vaccine-preventable diseases. And if you think of death as the tip of the iceberg, because there's so much more morbidity than there is mortality in vaccine-preventable diseases, the number remains very large for how well we're doing at preventing vaccine-preventable diseases worldwide. Now, I just want to show the same kind of graph, which again in the red here shows communicable maternal neonatal nutritional disease. Now, this is looking in developing countries under the age of 5 in 2010. And here, infectious diseases, and as well as maternal and newborn issues, remain by far the biggest cause of morbidity and mortality in the first years of life. So vaccines are available, and delivery has improved a lot worldwide, and there's been significant progress, especially in things like measles over the last decade, but we're still not doing perfectly well by any means. Done well, but not perfectly well in terms of existing vaccines. There are lots of new vaccines under development. I'm not going to go into any details of them, except to say that the list is large of vaccines that are being developed with the idea of sort of universal use as well as more specialized use. And this is a list. There's longer lists that you could have, but these are vaccines which are in at least the stage of trialing in humans. And I just bolded in the right-hand column 3, particularly because of the importance of these conditions. HIV, where death is not such a big deal in young children, but of course globally, worldwide, remains a big issue. Malaria, and then tuberculosis. While we have a tuberculosis vaccine, BCG, it's not a great vaccine. But there's a lot of development in a lot of different conditions for vaccines to be either newly developed in the first place or better vaccines than what currently exist. So now I am nearly at the end. So again, in conclusion, in Alberta we have an excellent program, as I said before, but we have not met our targets and uptake, and I can see that it's the same in at least British Columbia as well. In Canada and worldwide, not all vaccine-preventable infections are well controlled, at least partly because of limited delivery and/or limited uptake of vaccines. And so we can do better with our existing vaccines, and that's just the message everybody's already been saying. And then there are several high-impact infectious diseases with no currently available vaccine, for example, HIV and malaria. So do we have too many vaccines? My response is not yet. So with that, I'll say thanks for your attention, and I didn't even get the red card, so thank you.